Dr. Denise Cobble is our immediate past president and chair of our Leadership Succession Committee. Ms. Catherine Price is our secretary, recording secretary. Ms. Becky Baird is program director and director. My slide is not moving well. Dr. Flores is getting ready for clinical awards. She's our treasurer. And Dr. Mary Beth Reed is here somewhere, and she is on the Leadership Succession Committee, as is Mr. Brian Moore, of whom you will see a lot more in a bit. Dr. Deborah Hurd is not here tonight. She couldn't be here, but she is also a vice president. And you know what? None of this would happen, and probably half of what's in the College of Nursing wouldn't happen without Holly Woods. I just wanted you to know who all those people were so that you put a face and a name with the people who've really run this chapter for a long time. And what I'd like to do now is turn it over to Dean Merwin, who's also going to give you a welcome.
Thank you, Dr. Laird. And good evening, and welcome to Sigma's induction ceremony. Sigma is the International Honor Society of Nursing, and Delta Theta is our chapter at the University of Texas Arlington College of Nursing and Health Innovation. Sigma is an organization that is close to my heart and offers the opportunity for individuals who are chosen to be inducted into this honor society to have a ready-made community, a community of belonging, to share what we have learned as nurses with each other and to learn from each other. For those of you who are members of Sigma, you likely have proud and fond memories of being inducted into this organization. If you are like me, at the time of my induction, I had no idea how important Sigma would be to me in my career and how it would allow me to be part of a scholarly nursing community wherever I might go in my career. What it meant to me at the time was I was very pleased to be honored for academic achievement. Others were being honored for community achievement, and was very proud when my parents were in the audience at the induction ceremony. But I didn't quite know how much it would open doors and provide for community across my long career. As the Dean of the University of Texas at Arlington, I am delighted to have been given this opportunity to welcome you today. For those who are being inducted today, I encourage you to spend some time reflecting on your goals for your career in nursing, and give some thought to how Sigma can provide you with connections and community wherever you plan to go next in your career and then in the future. Sigma is truly international. As I've moved from state to state or college to college, and as I've done work internationally in different countries, always in connection with a leading school of nursing, I have just been amazed at how easy it has been to connect with fellow Sigma members. And there's like an instant connection And I hope you will consider in your goals how to take advantage and be a big contributing part of that community. I encourage you to participate in the scholarly opportunities provided by Sigma, be it attending conferences, local, regional, international, making presentations, publishing in Sigma's journal. Give some thought and consider how you will share your knowledge and expertise in nursing with other members and the profession as a whole throughout your career. For some, sharing your expertise and findings from research studies and/or quality improvement projects may be very natural, and you may consider it a common practice, and of course you would do that. For others, I suspect the challenge of sharing your expertise and experience through the professional literature may be a daunting choice. But you can reach out to other Sigma members for mentorship and to collaborate to support your professional growth in scholarship. I encourage you all to take full advantage of your membership in Sigma and participate fully in the community of scholars who make up Sigma. Thank you.
Next slide, please. Thank you, Dean Merwin. I'm going to take another little minute here to review the logo, the vision, and the mission of Sigma. The official organization is Sigma Theta Tau International, but it was rebranded as Sigma to make it more recognizable. So it is Sigma Global Nursing Excellence. And the laurel leaf is culturally very specific to and relative to our organization because it recognizes excellence and recognizes also leadership. So it's historic, it's cross-cultural. You can see that the last little, can you, next slide, please? Who's advancing the slides? Hello? In the booth. Can you advance the slide to slide 4, please? So Sigma is global nursing excellence, and you're going to hear a little bit later how global we are. Our mission is to develop nurse leaders anywhere to improve healthcare everywhere. And our vision is for us to have connected, empowered leaders transforming healthcare. So I will stop at that, and I will give the podium over to Mr. Moore, who will discuss the history and symbols, other symbols of Sigma.
And next slide, please. Sigma is definitely a diverse organization, as you saw in the previous slide, in over 100 countries internationally. And so we have a great opportunity to spread our message that I'll be telling you a little bit more about our organization, and to be able to do that internationally. Delta Theta is involved internationally as well, and you'll hear more about that a little bit later. Sigma members are leaders at all levels of the healthcare industry. The society only extends membership to students in baccalaureate or graduate level programs who have demonstrated superior academic achievement. To be invited here today, you had to be in the top 35% of your class. Congratulations. Our membership includes top-notch nurse executives, clinicians, educators, researchers, policymakers, entrepreneurs, amongst others. You are among this distinguished group of nurses because of your induction into this organization. Students and professionals who have met or exceeded those rigorous standards are invited to join Sigma. Formed in March 23rd of 1980, Delta Theta Chapter 102 it was established at Sigma Theta Tau International Honor Society in Indianapolis, Indiana. Next slide, please. Sigma Theta Tau, love, courage, honor. Our founders chose the Greek letters Sigma Theta Tau, taken to mean, the words mean love, courage, and honor, as they believe them to be the enduring values and the root of the professional organization. The name Sigma Theta Tau embodies the values of the Honor Society. Sigma, the Greek letter representing love, the love of family, the love we have for our nursing family, the love we have for our patients, and for lifelong learning. Theta, the Greek word for courage. Nurses all over the world showed great courage during this troubling time. And certainly in January of this year, for the 20th year in a row, nursing profession was voted the most trusted profession in the nation. Tau is the 19th letter of the Greek alphabet and represents honor. We practice honorably, we honor our fellow citizens, our patients, we honor our families, and those who sacrifice for our freedoms. Next slide, please. The crest of Sigma will be on your certificate that you will be presented today. Our crest, which adorns the membership certificate, symbolizes these enduring values and remind us of our commitment to wisdom and discernment, represented by the I. Service, professional endeavor, strength of leadership, and represented by the pillars of stone on each side of the shield. Knowledge is represented by the lamp. The stars, 6 stars, represent the 6 founding students who founded the organization, and the crest represents the commitment to service and professional endeavor and strength of leadership. Next slide, please. The key, which you will see many of us members wearing, have a significant consolidation of these emblems as well. Embedded in the key symbolizes a commitment to nursing excellence because of your achievement academically and leadership that you've demonstrated while in school, and reminds us of the charge to uphold love, courage, and honor, and is a symbol of scholarship. The pin is designated with the Greek letters Sigma Theta Tau at the top, representing our charge. The cup denotes the satisfaction of our professional life. The circle with the 6 stars represent our 6 founders, and the lamp of knowledge is at the center. So that's a little bit about the symbolism of our organization. I'll now invite Dr. Denise Cobble to come up and introduce our speaker. Dr. Cobble is our past president of Delta Theta Chapter.
Welcome, everybody. It is my pleasure and distinct honor to introduce you to Dr. Mary Teets. She is the recipient of the Myrna R. Pickard Endowed Professorship at the University of Texas at Arlington, College of Nursing and Health Innovation. In that role, she is also the affiliate representing nursing to the UTA Multi-Interprofessional Center for Health Informatics, a collaboration among numerous health informatics entities and led by Dr. Marion Ball as the executive director and Dr. Gabrielle Wilson as the assistant director. Dr. Teese has contributions over the past 30 years. They have been based on a combination of interprofessional informatics and telehealth technology. For interprofessional informatics, she implemented one of the first bedside nursing computer systems in the U.S. Isn't that awesome? That's amazing. Using barcoded medicine administration and a team of nurses, pharmacists, and information systems professionals. More recently, in 2016, Dr. Teets was co-investigator in a Texas-wide multi-method study to examine over 1,000 nurses' experiences using their electronic health records, EHRs. Dr. Teets is also a co-author of an AJN Book of the Year, Nursing Informatics for the Advanced Practice Nurse, Patient Safety, Quality Outcomes, and Interprofessionalism. She has been a longstanding member of the Technology Informatics Guiding Education Reform Global Initiative, working on harmonization of informatics competencies and website improvements. She received her BSN from Washburn University, her MSN from Kansas University, and her PhD from Texas Women's University College of Nursing. Dr. Teets is a fellow of the Healthcare Information and Management Systems Society and is certified in nursing informatics from the American Nurse Credentialing Center, where she's also a fellow in the American Academy of Nurses. She has been a member of Sigma Theta Tau since 1977. So let's all welcome Dr. Teets.
Thank you, Dr. Cobble. It is a pleasure to be here today. Greetings to the UTA faculty, UTA alumni, Dr. Merwin. Greetings to the committee that put this together, to the staff and the technology support that we have here today for this wonderful event. Greetings to the Delta Theta inductees, yay to you for being here today, and the alumni that are also here today as Delta Theta members. Most importantly, thank you, greetings to you, family members and significant others, because we all know nobody gets here alone. So, great to you. This is about you all, and it's only a select group that is here today. So thank you for supporting them. It is my honor to speak on a subject that is special to me, and I appreciate that I have been asked and I've been allowed to pick the subject of my choosing. So please, could you please put the first slide up? And it is. Okay, good. So, Compassionomics. The interpandemic, we're now not post-pandemic. I don't know that we'll ever actually be post-pandemic. We live now with interpandemic era and the relevance of Compassionomics for nursing and for informatics, because that's what I do. The authors of the book, next slide, please. Okay. This has to, can we see the next slide? Okay. Okay. I was looking for one that has a book on it called Compassionomics. Yeah. Well, I'll talk about the book. Actually, I have it with me. It is about two authors. One of them is, you can go to the first slide again, Dr. Stephen Trebeck and Dr. Anthony Mazzelli. They're both, one of them is an emergency department physician and one of them is a research scientist. And they were wondering about their patients and what kind of compassion they might be experiencing. So they started looking at compassion. And there are three things about compassion that I want to talk to you about today. One is the patient in a 12-hour shift. So listen to this story. By now, there was a physician, a patient, 34 years old, who had had basic, routine abdominal surgery, but actually ended up in ICU on a ventilator as a result of that. While he was in ICU, he was able to be alive for many of the days. He was all 120 days in the hospital. And one of the things he said that struck him about the ventilator is he couldn't talk, and he was just there on the ventilator and could not do anything. Thankfully, he did make it off the ventilator, and he was able to make it out of the hospital. When he was through with that experience, he wanted to talk about it. So he said that somebody asked him, what's the difference that it made for you being able to survive through the ICU? What gave you the strength through that horrible experience? And he said that, so the difference that was made that allowed him to be pulled through was to be strong enough to breathe on his own. The answer was simple: the nurses. But that was not any nurse, and it was not every nurse. It was a few special nurses that he considered his angels. After recovery, the man told his story, and it was published in the Boston Journal, and it was called A Patient Story. He said, after weeks of being on my ventilator in the ICU, I could tell right away when a new nurse entered on the new duty, the shift change, and it entered my room, I could tell within 1 minute whether or not that nurse cared. Within 1 minute. He said it was the difference between a good shift of 12 hours and a not so good shift of 12 hours. Now, they're all technically competent. There was nothing about that. It was just the difference in the caring nature that he was feeling from the nurses. If it was a nurse who did not care or exude compassion, my heart would sink. My spirit would be crushed. I lost my will, and I did not believe I would get off the ventilator. But if it was a nurse that cared, and one of my angels, I would instantly feel stronger. I believed I could do it. I could beat this thing, and I could breathe on my own. Never would I have made it through that without the compassion, and that is the compassion that saved me in all of that. So that was the beginning of what compassion does and the difference of a patient. Another example is something that happened in Sweden in 2007. A terrible car accident, 2 buses collided head-on. There were only 6 deaths, but there were 56 survivors. And they too were studied over the 5-year period. And after that, they were asked, what were the things that you remembered the most about that experience when you were being taken care of in that trauma? And the answer was consistently that after years of the survivors of 5 years, what they remembered was the pain that they experienced, but the lack of compassion. Now, remember, when you're a first responder, you are in there just to take care of that injury and get it going to the next step. But that affected the patients of like, hey, they needed compassion from the caregivers. And compassion is more than just expressing sympathy. I'm sorry you're got a broken leg. It is empathy towards the person. It's a person's particular situation that you care about. It's the action that you exude, meaning that compassionate person's emotion response is focused on, this is the key word, helping. You want to make a difference. That's what nurses do 24/7. But there's a difference between caring and caring and compassion. There you go. Thank you guys, you're up with me. That desire to care is different than Compassionomics. The third example that's coming up is a patient who's in terminal cancer. And he was a 40-year-old who had cancer. They could not help him survive. In the 10 months it took for him to lose his battle, he wanted to make sure that people who knew that compassion made the difference for him too. And he started a center. It's now known as the Steve Schwartz Center for Compassion. And it's to help compassion towards caregivers. Because once caregivers get compassion towards them, then they can be compassionate for others. And so this is the Schwartz Center, and that was for the patient who had cancer. So the difference between caring and compassion, you had that slide up there. As you can see there, caring is being kind for someone. It matters that you're there. You're happy to be there. Compassion is taking and suffering with them. It is the action orientation that goes along with that. Next slide. So, what about in compassion in the pandemic era? Some people say it takes too much time, and especially in the pandemic era, we were worried about time, right? We were overwhelmed. We had too many patients to take care of. But compassion only takes 40 seconds to make a difference. In one study, as it relates to the pandemic and what we're experiencing, they actually did a survey with patients who had cancer. And the patients who had cancer and they were told they had cancer usually have a lot of anxiety, and if any of you have experienced that, you know what that means. So they actually studied a randomized controlled trial where the provider of the information, the oncologist, had this message to say, and just listen with me, see if you can hear the compassion. Here's what the message said. I know this is a tough experience to go through, and I want you to know that I am here with you. Some of the things that I say to you today might be difficult to understand. So I want you to know, to feel comfortable in stopping me, and something that I say is confusing and doesn't make sense. We are here together, and we will go through this together. And so the information gets across and so forth, and then they close with, I know this is a tough time for you. I want to emphasize again that we are here in this together. I will be here with you each step along the way. Now, the physician isn't committing that much to it. The physician will be there along the way. So it's not over-promising. It's just saying, I'm here with you. And that's really what the patient needs at that time. It takes 40 seconds to do that. So what we learned from that study was you can reduce the anxiety for the patient by those words in that script that was provided, but also it doesn't take that long. So another thing that is evident is that, as you know, Maya Angelou, people will forget what you said, they will forget what you did, but they will not forget how you made them feel. Next slide. Facial expressions matter. This is both compassionate. One is kindness. One on the left is kind of, I'm happy, I'm your nurse, I'm here today, and I'm going to be so kind to you. The one on the right is, the eyes are a little bit bigger. They're direct contact to the patient's face and talking is another one that's compassionate, of empathy. Okay, so compassion is complex, but you can do it with little cost of time. Next slide. So, what is compassion? It is the suffering that you experience along with the patient. It is a little bit different than empathy and altruism. It is actually there for those who are feeling it, and the thoughts include the desire and the related actions to help. It's action-oriented as opposed to the empathy. Next slide. Now we're going to talk a little bit about the pandemic. There we go. Next slide. So before the pandemic, it was common to have caring, and caring involved there's advocacy, compassion, competency, and essence, and that was pretty common as we were experiencing our usual caring in the hospitals and so forth, and care delivery. Well, when the pandemic, we were all needing compassion and caring, and so burnout, moral injury, that is something that we were all experiencing. Got this from Barbara Chapman. She was here this week. Moral injury can occur in response to acting or witnessing behavior that to go against an individual's values or their moral beliefs. That's moral injury that we were experiencing. Burnout happens eventually, but that is what we're all having to deal with. So, along with feeling that, we were going through time all in need. Next slide, please. And so what I suggest is that Compassionomics for each other and for the patients can actually improve the process for us. Next slide. So compassion is the ultimate and the most meaningful embodiment of emotional maturity. It is through a compassionate person achieves their highest level of a peak of who they are as they reach in or others and self-fulfillment. Next slide. So, how are ways that compassion can impact nursing and nursing care? Next slide. Some of you may have studied the triple aim, those of you that are in school, right? The Institute for Healthcare Improvement indicates that if you have population health intersect with experience of the patients as they get cared, and a per capita cost that's not too extravagant, you have achieved the triple aim. That's what our country was aiming for. But then we just realized something. The provider isn't in there. We're taking care of the patient and the economics and their experience. So the quadruple aim is including the provider as part of that aim. And it actually indicates that there are, and it was noticed as the burnout and the moral injuries were occurring. And so now, more and more, we're focusing on the providers themselves. Next slide. So this is an example of what we do whenever we try to get together as an organization and make a difference for the providers, okay? It's called All In, Well-Being for the First for Healthcare, primarily for healthcare workers. It is a combination of a coalition between the first responders group. It's an association for first responders, and the Dr. Lorraine Breen Heroes Foundation. You might recall that Dr. Breen is an emergency department physician, who took her life in New York Presbyterian Hospital. She said that the virus was getting it all. She couldn't beat it. And therefore, it was just too much for her. And so this foundation has evolved from that so that people are aware that it can happen to anybody that's experiencing that type of moral injury. And so part of it is getting together with these 5 key components. And for those of you that aren't in healthcare, but those of you that are going into the healthcare world, think about these 5 things. Number 1 is the lines. That's the lines with the little balls on them. That indicates that they are clinicians. It is a need for action relating to giving clinicians more flexibility and autonomy. For example, they are there to partner with them and also to realize that things are not as normal as they used to be. We're in a different era now, and we will stay in a different era now. The other things we can do there are, for example, to stop stupid stuff, do things differently than we used to do, and also move into that future. The arrows indicate get rid of the stupid stuff, and that some of that is the documentation. The hands indicate that we need to get radical about frontline workers and being able to indicate that staffing needs to be adjusted. We need to send executives to the bedside. We need to have voluntary redeployment of clinical staff. We need to create new types of shifts for the new kinds of shifts and more creative types of shifts. We need to train and upskill nurses, LVNs, LPNs, MAs, everybody trained to do things in healthcare delivery all together. You can't just make more of us. We have to think differently about that. The multiple people icon has to do with having a designated executive for wellness. Who in the organization is responsible for the wellness of the employee? It's not just HR, it's not just your manager, but someone with an executive with the abilities to make that happen. And it needs to be an appointed person with that responsibility. And then the hand with the heart on it is that EAP, Employee Assistance Programs, is not enough. We've outgrown that, guys, okay? What we need is serious mental health care to implement the 3 key components of a good mental health program. Number 1, quality mental health counseling. Number 2, peer support for those that are in need, a peer support program. And number 3, psychology first aid training for everybody so that you can recognize when your coworker is potentially in need, as we have seen that happen more commonly than we like to say. So we have to notice the symptoms. Next slide, please. So now, as an informaticist, this matters to me. Next slide. And I take it into the study. Dr. Cobble mentioned it, that the statewide study in Texas indicated that nurses experiencing distress in the use of the electronic health records. We're fixing them, but we're not fixing them fast enough. Okay, so next slide, please. You know, based on that, we actually asked, this was a combination about the Texas Nurses Association, the Texas Organization of Nurse Leaders, to say those are the CNOs of the hospitals and the nurse practitioners that are carrying or that are using the EHRs. What can be done? And so what we did was we looked at what we had throughout the whole state of Texas. And next slide, please. 1,000 nurses participated 2 times. In 2015 and in 2020, we did it again. Have we improved over the 5 years of when we did it initially? Next slide. And this is a little bit of what was said there. To cut to the chase, We haven't improved like we wanted to. We tried, but we are doing a little bit better, but there's still some trouble. This 350 of the 1,000 nurses gave us paragraphs of their experience. We left one box wide open in the online survey. And this is an example of what was said in both the ethics that they have to experience on a daily basis. Using blank blank EHR system vendor has increased my workload by minimally a multiples of 2, okay, which equates to a great deal of time. As you can say, I could provide patients care in that time. I should never have to make a decision on whether my time is spent charting on my patients. My patients will always come first, and this EHR, not to be mentioned, has taken the valuable time I have spent with and care for my patients and suffocated my time in documentation. We all are working on that. This is a known fact, but this is moral injury, okay? It's not burnout. It's like this is not tying with what I learned. It is not tying there. So next slide. Along with all the other nurses, we actually came up with there were information systems issues, there were professional ethics system issues, there were patient care quality standards issues, there were organizational culture issues. Again, that's on me, informaticists, to take care of. But what I want to do in the meantime is be compassionate to those nurses. That's all I can do, and be listening to them. Next slide. So, pay it forward. This is kind of wrapping it up here, okay? Overall, healthcare has changed, it has matured. We have grown out of the pandemic that we've just experienced for the past couple of years in a way that is somewhat painful at times, but it is where we are. Compassionomics has been defined and is needed. For the graduates and the leaders in the audience here, compassion begins with faculty, and it also begins with leaders in the hospitals. It is a reflection of your maturity to carry out compassion with those that you come in contact with. This includes assignments, simulations, training that you may be doing. All of that has to be infused with compassion so that that can be taught outgoing, and you need to infuse it yourselves as you are training on that model. Undergraduates, and I'm sorry, I did realize, I don't know if y'all have graduated or not yet, if it's tomorrow, but okay, graduates, new graduates, okay, that are going into the workforce. Regardless of who instructed you or what you were trained with, you can be an ambassador for compassion. You can be that person in the ICU for that patient that makes the difference, the one with cancer, the one that just had the bus accident. You can do the difference there. In practice, some of the things that have been defined as compassionate: sit beside a patient instead of standing over them. Lean forward, not backwards. Make direct, sustainable eye contact with the patient. Note your tone of voice. Watch your facial expressions. Talk less. Raise an eyebrow every so often. Listen, nod your head in acknowledgement. This takes practice, but as studies show, it can be done. Next slide. So, compassion in medical school, this comes from doctor and medical school training. There is not always something you can do for a patient medically, but there is always something you can do that validates their fears, empowers them, and shows them that you're trying to help them in every way possible. Doesn't take but 40 seconds to do that. So, watch for big problems. We may have them. They actually can be disguising big opportunities for us. Thank you.
Thank you, Dr. Teets, for speaking with us today. Now is the time I know that you're all actually here and excited for. I'd like at this time to ask all of the inductees to rise and please move to my right. And the faculty who will be courting, please come to the courting table. As you proceed forward, you'll come in front of the stage on the floor and in front of me in the podium and over to Dr. Laird, and we will have a photographer over here taking our pictures that will be available for you later. Once you receive your cords, if you'll proceed around the auditorium to the back where you'll receive your membership certificate as well as sign the membership book. Sarah Pittman. Courtney Woods. Audrey Lemon. Monique Hardial. Rachel Colors. Michelle Ordonez. Kristen Marshall. Michelle Sparkman. Leisha Williams. Catherine Euban. Brianna Misiasic. Emily Cruz. Trenton Meyer. Joanne Sia. Tunazia Amid. Alyssa Higginbotham. Brandon Starr. Sierra Cromer. Amy Wisdom. Mary Rose Obidiaku. Jennifer Jacobs. Gina Bollinger. Brenda Height. Sean Beatty. Samantha Lonthone. Kalista Reimer. Michelle Hannon. Karen Ashman. Yvette Lorea. Michelle Vick. Alexa Rubagos. Brianna Rubagos. Annie Lee. Allie Bash. Vanessa Munoz. Valerie Martinez. Emily Andrews. Noelle Carpenter. Madison Durin. Deepshika Baria. Polly Cordova. Maricela Conejo. Monica Voica. John Bolo. Mitzi Gomez Ventura. Celeste Lara. Emily Shelton. Jordan Elizabeth Dudley. Troy Petit. Amy Tomlinson. Joyce Robinson. Rita Kamari. Aliyama Matthews. Christiana Yuvitsteva. Kenneth Height. Let's give all of our new inductees a round of applause. Congratulations.
So now we will ask the inductees to resume their seats. After you get your certificates. And as soon as you take your seats, I'll ask all the RNs to stand and repeat the pledge after me. If you're at home, please don your cords and prepare to say the pledge. So everybody who's an RN, please stand. You should have the printed pledge in your program. A couple of people still getting signed in and certificates. So we'll go ahead. I accept membership in Sigma Theta Tau International You are now proud members of Sigma. You will be a member of Sigma all your lives, and your home chapter is Delta Theta. Now, some of you will be going to other areas. You may maintain your membership in Delta Theta. You may change to another chapter, or you may be members of both chapters. But I want to tell you just before we leave, please be seated. I want to tell you a little bit about who we are as Delta Theta. Next slide, please. So you can see that Sigma members save lives and money every day. We are very, very committed to our patients, and Sigma is there for you. As the dean said, there are at least $1,500 worth of benefits every year that you can have being a member of Sigma. Now, you keep your dues paid up, you can keep it on your resume. Now, what are the benefits of being a member of our chapter? Well, you get lots of mentorship, leadership training. We can provide you with networking. You can have opportunities to present your work. We are very committed to UTA College of Nursing and to the university. We have 4 endowments. Next slide, please. We have an undergraduate nursing scholarship grant. We have a graduate nursing scholarship grant. We have a graduate faculty research grant, and we support dream makers. Next slide. We also support our students with donations to the food pantry, and I think we gave $500 the first time and $2,021 this last one. Sometimes we provide snacks when people are taking exams on finals on campus, but that hasn't been going on lately, so we also provide snacks for other events. And because we know our colleagues in the community have been working so hard, Delta Theta provided what we call gratitude gifts to the emergency departments of 6 hospitals, 3 in Dallas and 3 in Fort Worth. Coffee and snacks and Chick-fil-A and snacks, and that was very well received. In 2020, 2021, we were asked to make a significant commitment to a, the matching grant to the Smart Hospital. And because we've been good stewards of our funds, Delta Theta has just given the last of a $50,000 donation to the Smart Hospital. So if you look at the little, diagram up there, you see at the end of the hole that blue rectangle. That's going to be an open space, and it's going to be the Sigma Learning and Engagement Center, and it will be made possible by our donation. Now, those are local things, but I want you to know that this chapter is global. We support the Rebecca Ann Naylor School and Institute of Nursing in Bangalore, India. You'll see Dr. Naylor there. She's retired now, but she was the first female surgical resident at UT Southwestern. And when the Baptists asked her what were her 3 places she wanted to go to, Bangalore, India was number 3. So which one do you think she got? And she grew that hospital over the last 40 years, and she knew that they needed a nursing school. And so we've been next slide, very instrumental in that opportunity. And right on this stage, we were able to give from Delta Theta the first $5,000 from a region, we're in Region 6. We gave the first $5,000 for their new technology learning kind of lab in the dorm. Nurses, young ladies in India do not get flats with 3 guys and 2 women, you know? You live in the dorm, not like I did in London. Next slide. So the other thing, group we support is the Haiti National School of Nursing in Port-au-Prince. And you'll remember that horrible earthquake they had, took out the whole second-year student body and several faculty. Dr. Ellen Palmer, who's a past president, and Miss Becky Baird have been heavily involved, next slide, in the Haiti School of Nursing. And you can see some of the students there. We've just given money for their graduation, so some of the money could go to let them have a cap and gown, so they felt like it was a real commencement. And then each student got $50, which to you doesn't sound much, but to them, they get a little stipend because they have to travel to take their national exam. Some of that stipend doesn't cover how much they need for the travel. And then they have to pay for their uniforms and their shoes, and they have to work for a year to pay back for their university, for their education. This is a state school. And you can see Jocelyn Arnaud there. Jocelyn is the former director of nursing, and she is a member of Delta Theta. The other slide you see here is where they've been doing some CPR education and pediatric education. Moving on, we also contribute to the Giving Circle, and we're able to bring in, next slide, international students. You see the young man in the floral shirt between Dr. Palmer and me. He's from the Philippines, and he was able to attend the big biennial conference in Indianapolis and present his work, and we had another person who had to present virtually. Now, next slide. Every year we induct a new international president. We are an international organization, and the president this year is Dr. Dion, and instead of the president giving a call to action, it is now an organizational call to action. And so we have been called to be bold in who we are as nurses, to speak out for our profession, to be involved in the language of economics. You can see his full speech. I won't go into it here. But when we talk about economics, be economical in the way we care and the way we deliver care, to conserve, not just in the planet, but also to conserve professionally. And so all of these things are very, very important going forward. So I would encourage you, as Dean Merwin said, to be bold, come out of our silos, talk to each other, learn about your pharmacist. engage as a partner with your pharmacist as you take care of patients in the hospital. I taught pharmacology here for 10 years. Some of you hated me. But it's important. You needed to know that. You need to know what you're doing. Get involved with your magnet committees in your hospitals. Get involved with your practice committees. You can show, you don't have to be the CEO or the head nurse to be in leadership. You don't have to be in a line position. You can be a leader. You are a leader. So I would like now, next slide, just to say another hearty congratulations. This has been a wonderful opportunity to be together. And next slide, I just want to thank